Hi everyone, so today we are here to talk about heart health and why it is important to take a second opinion for cardiac conditions. As we all know that heart pumps blood to the body and with it oxygen and many vital nutrients. Any abruption or disruptions in the normal flow of heart due to a disease or illness can impact the normal functioning of the heart and with it functioning of other organs as well. So I would like to begin by asking you that does all cardiac conditions require surgical treatment or can they be medically treated as well?
So I think Sunidhi, like depending on the type of heart disease you have, your cardiologist will recommend a particular treatment plan for you. So like not all heart conditions will require a surgery, and many of them can be addressed with lifestyle changes and medications. So yeah, I think a cardiologist has to weigh in a lot of factors while deciding that. So for instance, nowadays many people are opting for minimally invasive surgical procedures.
Right.
So because these procedures are less invasive and they have a faster recovery, and they are also less risky. But it's not necessary that your cardiologist will prescribe that treatment for you. For example, there's this procedure called as coronary angioplasty. So in this particular method, this method is used for treating blocked coronary arteries. So here nowadays people are using a stent in this particular procedure. A stent will be placed in your blocked arteries to prevent them from narrowing. So this will help with chest pain and also prevent heart damage later on. So it is possible that your cardiologist will recommend this treatment for you, but the cardiologist may also recommend a bypass surgery for it. So depending upon various factors like your age and the extent of blockage in your arteries in your body, the cardiologist will decide that. Because like for older people, bypass surgery is not that recommended because of their age. So they will be told to go for a coronary angioplasty. So when a cardiologist makes a decision about your treatment, he has to weigh all the options that are available for you. And most of the treatments that we are recommended, they are not singular in nature. They are very comprehensive. So for instance, like if you have been diagnosed with heart failure, then your cardiologist will not just say that take only medications, because heart failure can be managed with that. Right. But the cardiologist can also tell that make certain lifestyle changes, and he may also tell you that there are various devices, implant devices that surgically they can be inserted in your body. Right. In order to help or assist with blood pumping. So I think the best thing to do is, if you have been diagnosed with a heart condition, consult with a good cardiologist. And if you're not satisfied with the treatment options that you have received, you feel like that there are maybe other better options for you, then you can go for a second opinion with another cardiologist.
Right. So I was going through some studies, and while going through them, I got to know that age also play a major role in heart health. And also along with that, I think there are many comorbidities like diabetes, which also play a role in heart conditions. So what do you have to say about that?
So yeah, I guess age is a risk factor for heart diseases. Because people who are above 65 years of age, they have higher chances of getting stroke and heart attacks also, and they are more likely to be diagnosed with coronary artery diseases. So it basically happens because as we grow older, our heart also ages and changes its structure. There are changes in its structure as well as in its there are changes in our blood vessels as well. And as we grow older, and because of our diet or lifestyle habits, I would say there is also buildup of fatty deposits in our blood vessels, which can block them and lead to coronary artery diseases. So that can even culminate into a heart attack. So yeah, age is a risk factor, and if you think that because of your higher age you are at risk of having a heart attack or any other such heart condition, then you can talk to your cardiologist and discuss what type of lifestyle changes you can make. Also, yeah, it is true that people who are obese and who have hypertension and diabetes, they do have a higher chance of heart failure and other such heart conditions.
Right. So as you rightly pointed in your answer, that lifestyle has been shifted to people are more relaxed now. There is less physical activity, and screen times have been increased. Jobs have changed. So all this is also playing a role in heart conditions.
Yeah, true. Yeah. Because the lifestyle that we have plays a huge role in our heart health. So like for instance, many people have the habit of consuming a lot of foods that are rich in trans fat or saturated fats. Yeah. So these can lead to atherosclerosis. and there are many people who don't regularly exercise. So yeah, that can also increase the risk of obesity and diabetes, which are other risk factors for heart diseases. I think it is also advisable to stop smoking and consuming too much alcohol, because these habits can also lead to heart damage. So having a good lifestyle is always a good thing for your heart.
Despite many recent advances in the diagnostic techniques and treatment in the cardiac care, misdiagnosis is still a common concern among patients, and most of it has been owing to overlapping symptoms in cardiac care. So, what is the relevance of getting the right opinion on the care, and how can a patient avoid misdiagnosis in such cases?
So I think a diagnosis of a heart condition is worrying for many people, and many patients are told that straight away that you need to get a surgery, and surgery is the life-saving procedure for you. But I think it's always best that you get a second opinion on your diagnosis, because this will not only help in confirming that you have been diagnosed with the correct condition, but you will also get to know more about your treatment options. So consulting a specialist who has a cardiologist who has a lot of experience in dealing with the condition that you have been diagnosed with. So if you consult with such a person, then I think you can good second opinion will help you in deciding the course of action for you. So like you can avail various services as well for that. So like Medigence has a second opinion platform where you can upload your all the information about your diagnosis, your symptoms, as well as the results of your diagnostic test. And then you will be connected to a cardiology board, or specialist cardiologists, cardiac surgeons, who will review your case, and then they will give their second opinion on your diagnosis. So once you have been confirmed with your diagnosis, you can go ahead with the treatment options that you feel are good for you. And most importantly, I believe a second opinion is for for your peace of mind, so that you are reassured that you are doing the right thing for yourself.
So cardiac care doesn't really stop when a major procedure or a treatment ends. A patient is mostly shifted from a cardiac surgeon to a cardiologist for medical management. So what do you think is the relevance of post-operative care or post-treatment care after a cardiac procedure?
So cardiac care or rehabilitation after you've had a heart surgery or a heart attack is basically aimed at helping your chances of recovery. So this can include exercises that can help you get back your strength and prevent your condition from worsening. Mostly doctors would recommend low intensity exercises like walking or running. You can even do yoga if your cardiologist recommends it. You will be connected with a team of professionals from different backgrounds. It will be a multidisciplinary team of cardiologists, nutritionists, sometimes even mental health professionals who can give you the emotional support you require, and you will be educated about the different lifestyle changes that you can make about your condition. So I think rehabilitation helps in those aspects, so to get your life back to normalcy.
Yeah. In today's time, when everything is going digital, do you think that it is the right option to opt for virtual second opinion services, and are they as effective as physical consultations?
So yeah, I think it's a good choice for people who have been diagnosed with heart conditions. For example, if you have a family history of a heart condition, a heart attack, or someone in your family has recently died from a heart attack, and you have been diagnosed with a heart condition, so it's always best if you can avail a consultation from the comforts of your home. So a second opinion that can be availed in a short period of time, and that too from your home, I think is a good opportunity for people to understand their diagnosis, get a confirmation for it as well. So yeah, I think it is a good choice.
Right. So I think to conclude all of this, I would like to say that if you are dealing with any symptoms of cardiac condition, it is best to consult with a cardiologist. And if you have already been diagnosed with a cardiac condition, then it is a good choice to go for a second opinion. And Think Twice by Medigence is a great virtual second opinion platform where there is a clinical workbench, a board of cardiologists from global destinations who will review your case and who will go through your all your reports, and then they will provide their expert opinion within a stipulated period of time. So yeah, it is best not to take any chances when it comes to your heart. Thank you.
Thank you.